Dental implants are a long-term solution for replacing single or multiple missing teeth in a way that allows people to chew just as well as with natural teeth. Implant teeth can also look amazingly natural, giving great cosmetic results, but many people are still unsure of what exactly is involved.
The easiest way to think of a dental implant is being like an artificial tooth root. It replaces a natural tooth root with a small titanium cylinder inserted into the jawbone. The surgery is quite quick, and any discomfort should feel no worse than after having a tooth extraction. Most people are fine to go back to work the next day. The implant gradually bonds with the surrounding jawbone, and after 3 to 6 months is stable enough to support a new tooth. At that stage, a completely painless procedure records the shape of the implant and the teeth in the area, and a crown is made to fit the implant. A week later, the crown is attached to the implant and the treatment is finished.
With dental implants, you can enjoy the sensation of having natural-looking teeth that feel stable and strong. Dental implants help to eliminate the concerns and embarrassment people often feel when they suffer tooth loss. Dental implants also offer potential benefits for your oral and general health.
When you lose a tooth, the surrounding bone gradually shrinks away. Teeth nearby can drift out of alignment, and spaces open up between other teeth. This causes food trapping and makes it harder to chew food. The effect on someone who has lost all their teeth is considerable, especially if they wear full dentures. Traditional partial dentures or full dentures don't chew as well as natural teeth, and the bone continues to shrink under them, meaning that eventually the dentures will not be stable or comfortable to eat with at all. With dental implants, this bone shrinkage does not take place because the bone is taking the stress of eating and is stimulated to stay strong, just as people who walk regularly don't get as much osteoporosis. It is also a good option for anyone who has lost a single tooth, as implants are self-supporting.
One thing that often concerns people is whether they will be suitable for treatment, especially if they are older. The good news is that dental implants are usually suitable for most people, and age isn't generally a factor.
Provided you have reasonable dental and general health, there is a very good chance dental implants could help you. Indeed, older patients with more missing teeth tend to be the most common people to benefit from dental implants, and rightly so. Malnutrition is a big problem in the ageing population, and that is often due to loss of teeth. Eating well is very important to health in the elderly.
People who have lost all their teeth can find their dentures become increasingly loose and ill-fitting. This makes it difficult to eat a nourishing diet, and socialising can become a trial due to concerns about loose dentures. Dental implants can eliminate these worries, so meal times become pleasurable once more and socialising is something you can enjoy again.
There are 2 ways dental implants can replace full dentures. One option is a complete arch of fixed teeth or a dental bridge, which will remain permanently in place. A second option is an implant-supported denture that clips onto the dental implants, but which is removable for regular cleaning. This second choice can be very cost-effective, as relatively few dental implants are needed.
Anyone considering dental implants will need to have a full consultation, and this is a great opportunity to find out more about this treatment.
If you have missing teeth, I would recommend you come to Swansea Dental Practice and we can assess if dental implants are the right option for you. We can discuss possible procedures and we'll answer your questions about treatment. Every patient considering implants is carefully screened, as we want to make sure your treatment is successful. The surgery is planned on a computer and CAD/CAM drill guides are made to ensure the implant is placed in exactly the right position. This avoids injuring important structures in the jaws. The actual surgery is quite quick, and we will ensure that you're comfortable right through the procedure. And anyone who is particularly nervous can opt for additional sedation.
Dental implants have been used for decades now, and lots of people have already enjoyed many years of use. Implant-supported crowns and bridges are now considered the most effective way to replace teeth, being the most like your original natural teeth in the way they chew and look. Dental implants can be an amazing way to restore missing teeth. To find out more and to discover if you are suitable, call us today and arrange your consultation.